Hello, I'm Jessica Samuels. Welcome to A Way Forward, presented by Beam Credit Union. I'd like to acknowledge that this podcast takes place on the ancestral, traditional, and unceded lands of the Okanagan Silik people. Our topic today is about a new program to CMHA Kelowna. It utilizes a mobile and community-led approach for mental health services. And my guest is the manager of project development here at CMHA Kelowna, Jamie Lloyd-Smith, and she's going to tell us who this program is for and how it works. Beam Credit Union is proud to sponsor today's episode. With deep roots in BC and a commitment to your financial journey, Beam believes wellness, mental and financial, starts with support you can count on. Jamie, thanks for being here. Let's start with a really easy question. What is CRCL?
CRCL. It is a great question, though. So CRCL, the acronym is CRCL. So what that stands for is Crisis Response Community Led. So we're calling it CRCL. But really, it's in the name. So we're thinking about how we respond to crisis in community, and the way we want to do that is through a community-led approach.
What does community-led approach mean?
So for us as an organization at CMHA Kelowna, we know the impact of this service. As an organization and a history of working with people who've experienced mental health challenges, who may experience mental illness, we know there's a gap for people who may be experiencing a mental health crisis, who don't know where to go. And when they do reach out for help, it might be met with an enforcement-led approach. It might come with a police officer, which isn't always the right service in that case. So for us, it's a model of doing this in community. And what that looks like for us is everything from the team makeup, but how we work with partners. So something that's really awesome about this program is it's made up of people who have a mental health background. So that might be clinicians, that could be nurses, people with that academic and theoretical understanding of mental health. But it also brings peers. And peers are people with lived experience. They may have lived experience of mental health challenges. Maybe they've gone through crisis or they've navigated the system. They know what those challenges look like. And they sort of bring that perspective into community at sort of that grassroots level to really support people in whatever they might be feeling in that moment.
That lived experience or living peer support experience is really a foundational element of many things, particularly mental health services. Why is that so important, and how does that impact that support model for individuals who are experiencing mental health challenges?
I think as we do this work and we think about that voice of lived experience, when we don't include it, we're just going to get it wrong. Like we really are. For people who've navigated the system, for people who at some point in their life had that challenge, they need to reach out for help, they are the experts in terms of what is going to work for them. I'm proud as we've been developing this team and bringing staff on board with those diverse experiences. They've been telling us, what we can do to sort of make sure we're including the right supports and what that looked like for people. I'll give you an example, actually. Recently we were looking at our phone system for CRCL, and, what does this need to look like? Who needs to be answering on the other end? And our team said, right off the bat, I've called crisis lines and I've had a robot answer the phone, and I don't want that. I want a human on the other end. So including that lived experience, we just know that we're going to be talking to people who get it, whose experiences have shaped what their story looks like. And it's a reminder for all of us that anyone can experience a crisis, right?
Let's talk a little bit about that, because you touched on when you call. So we know they're not going to get a robot. Walk us through what will happen. Like, how does CRCL work?
Yeah, so really the way CRCL works, at its core, it is a mobile response team. So this is a service for anyone 13 years and up. And really, if you're the person in crisis, you can call, but you can also call on behalf of a family member, a loved one, maybe you're a neighbor. You can either call or text this number, and what you're going to be met with is ultimately a compassionate human on the other end who's going to ask you those questions, understand, where are you, what are you going through, And what we want to provide is that immediate in-person response. So a team will be dispatched and they'll come meet you where you're at. So if that's your own home, maybe that's a workplace, maybe you're at a community center, they're going to come to you and meet you on your terms. So a critical foundation of CRCL is this is a consent-based service. The person in crisis is in charge of what their journey looks like. If you call on behalf of someone and you show up and that person in crisis isn't ready to talk, no problem. We'll come when you are ready. But really, you get to define what that journey looks like.
Okay. And that team that you mentioned does not involve law enforcement, and it involves the folks who have the kind of academic professional experience around mental health supports or what the needs are for the individuals in crisis and peers. So, I think there might be this idea out there for folks who haven't had to call, or maybe who folks have called and saw something different, that it can be daunting. It can be scary to have these mental health folks come because you called and you're in crisis. Like, I can imagine there's this vision in this head that even that in itself would prevent people from calling. So it's not going to look like that. What are they going to look like? What will they be wearing? Like, I want details here. And I'm asking because, I have been asked this before about mental health services for folks who've contacted me and needed help in community. And they're like, look, I don't need a doctor and an officer showing up at my door. So what does it look like?
It's a great question. And we hear the same thing. Sometimes there's a trauma with uniforms or what that response might look like. You're going to get two people with empathy who care, who are wearing clothes like any one of us might be wearing, and who are going to sit down with compassion and understand what that experience is like for you in that moment. Okay. And ultimately, they're going to be there to help you. Okay. I think what is really beautiful about CRCL is that it's really up to that individual what that story looks like. Maybe in that moment, you just need to have a listening ear, and maybe you need someone to help you build that care plan. And both of those experiences are valid. And what's unique about this program, maybe comparatively to hotline services, for example, is that human face-to-face connection and building rapport with people in such a beautiful way.
It's community, the CRCL, it's community-led, meant for folks who are experiencing a crisis. You just talked about scenarios where it's led by the individual. They might just want a listening ear, or maybe they need something a little bit more. Crisis is something that is defined differently by the person witnessing it or experiencing it. How do you know that you can or should be calling this service? And I use that language because, again, oftentimes people feel like they're not in crisis enough. I can manage this. No, if I call somebody, I'm going to, be taken into custody or taken to the hospital. How do you know that it's the right time to call CRCL?
Ultimately, it is never the wrong time to call CRCL. And, I want to acknowledge the bravery and courage it takes for folks to make that call, right? To have that moment to say, you know what, I actually do need help in this moment. I can say myself, I've experienced crisis. I know what it's like to make that call and have that feeling of what you're going to be received. I've had family members who've experienced crisis. And what I would say, and what we talk about a lot as an organization, is don't wait to get the help you need, right? Something we talk a lot about this on the podcast is the word prevention. And what does prevention mean? And I think for folks, as you're nurturing your mental health, part of what we talk about is learning to sort of understand those early warning signs, right? And that's going to look different for each people. For some, it might, I notice I'm not hanging out with my friends. I don't want to anymore. Or I'm not sleeping as well as I used to. I'm not eating healthy, nutritious meals. And they start to notice, actually, maybe I'm slipping into feeling unwell. I think at the same time, we sometimes have that tendency to want to qualify how, good or bad our mental health is, right? We hear this sometimes from lived experience folks. Well, I'm anxious, but, I see what other people are going through. It's not as bad as that. So I'll wait until I'm as anxious as somebody else, and then I'll call. And what I want folks to know is you define a crisis in your life, and what that feels like for you is valid, and don't wait to get the help you need. And know that we understand how important it is to make that call, how brave it is to make that call. And we will be waiting on the other end to listen to your story and to support you in getting the help you need.
Right. This is Circle is in 6 other communities in BC right now.
That's correct.
And so we're talking about a program that is about to start here at CMHA Kelowna, but you actually had opportunity to visit another community and witnesses. So talk a little bit about the successes in that community and across the world, because this model, it's called Circle here, but it's not necessarily new elsewhere.
Yeah, the model of what Circle is really not a new concept. Some of these programs, when you look in the United States, for example, in Oregon, these concepts were developing in the late 80s, which for us who've been working in the mental health field for a long time have identified, people are in crisis, and what they often don't need is an enforcement perspective to enforce their way out of a crisis. What they really need is mental health paramedics and folks who are going to understand what that's like. We are really lucky to be the 7th community, as you mentioned, hopefully lucky number 7. And I think for us, that means we can really learn from other communities who've done this well. In my research, I was really lucky to travel to Victoria, who has a really robust team, meet with the people delivering the service, understand ways that they're partnering with other social service organizations, tips they've learned around, how to make people feel safe and comfortable, and also how do we work with all the folks who make up what we sometimes call the public safety continuum, right? Our other first responders, RCMP, police. These are all folks that still have an important role to play, and we want Circle to be part of that larger response.
Mm-hmm. Right. And that was part of my next question, is where Circle fits into that spectrum of mental health care and supports within our community. So how does it fit into that dynamic?
What we've often seen is there's a gap in sort of what might be available on a hotline through a phone number where you can chat with someone. And what we've heard again from voices who've been through this, and then that next line is 911. Mm-hmm. And so for folks in the middle who need that immediate sort of care, who are struggling, they don't want to call 911. They don't want that approach. And so they're sort of left to wait until things get worse, to wait until it is an emergency, and then to make that call. So Circle is really the step before that. This could be feelings of anxiety, of loss, what that crisis might look like. But ultimately, it's for folks who have that need before they have to call 911. Mm-hmm. So really, it's actually an intervention and an emergency prevention tool.
Right. And then from there, folks might be diverted or navigated to another service in that moment if they need it, or perhaps some more long-term part of their care plan.
Absolutely. A really important part of Circle is looking at how we connect people to the right supports. What I want people to know is when you call Circle, that's the start of your journey, right? Mm-hmm. If you need additional supports, our team has over 100 hours of training and their own experiences to help you navigate what those supports might look like and find the best resources for you. And in the case where maybe it is an emergency and actually there is that safety mm-hmm. to the person, we're also going to refer to 911 to ensure that that person is safe. And work sort of in lockstep with others providing important service.
Okay. And for folks who might be familiar with some of the current services in our community, whether through their own experiences or just being informed, how does this differ from stuff that is existing? So specifically, we have the PACT folks or the PACT team. Is this a tweak of that? Will that still exist? Maybe you can talk about the difference between Circle and PACT.
Yeah, so the PACT team in community, that's the model of pairing an RCMP officer with a nurse. And this was a significant step forward in terms of, the mental health continuum of care. What really distinguishes this, though, is there's still that police force present, right? So while the nurse is there and to provide that sort of support for people who may need that, CRCL is sort of, again, that step before the PACT team, right? So it's sort of that immediate intervention, and sometimes it's intervening just so we don't have to call police, right? To de-escalate in that moment. So really, it's, again, that step before PACT and then a 911 call.
So PACT will still be in place. It's just a different use.
Absolutely, right?
Yeah.
And CRCL is distinct and different in that sense, right? The team makeup is different than what you'd see on a PACT team, and also the response model is different. And it's different because there's different needs, and we need that array of services.
What I appreciate about this, and knowing that this was coming down the pipe, is that it's another avenue for folks who are struggling, but the loved ones, when our loved ones are struggling, and you're sitting there and you see that they're struggling and you're trying to understand how to help them. You don't know how to help them. And you are like, oh, do I call? Do I not call? What's going to happen when I call? And, I say, people are not okay right now. Like, a lot of people are struggling, and a lot of families are struggling. And I see this for myself personally, when I heard about it, as really filling that gap and that warm welcome and that warm response that will kind of smooth the way depending on what the next steps are.
I think what you just shared is going to resonate with so many people. There's a fear of what they're going to experience if they call a certain number. Sometimes there's not just a fear, there's just that burden of, am I going to be on a wait list? Am I going to have to call 8 different numbers to try to figure out what the resource is for me? What makes me excited about this program is that idea when people are struggling, it's not calling to wait on a wait list. It's not calling to sort of maybe get a call back in a week. You're going to get help right away. We're going to meet you in that moment and build that care plan together, especially for families who sometimes struggle in just knowing what that step is, what that needs to look like, and so desperately want to help their loved one and just don't know where to go. To provide that resource where they know that their loved one is going to be treated with dignity and compassion, but also in a voluntary manner is amazing. It's something we haven't seen before.
This is a new program for CMHA Kelowna. It's tested and tried in other communities around the world, around the province, as you mentioned, under different names. But now what we want to know is, when will it be accessible here in Kelowna? Because it's still getting off the ground. So when will people be able to access CRCL?
Yeah, we're excited to be launching in early 2026. And so we'll be sharing out through CMHA Kelowna, what that response looks like, what that number is, when you can call, and really just trying to eliminate those barriers for people to understand how to access the program. And we've been hearing from so many folks, when can we start calling? Because the need is there. And that's something that we look forward to.
All right, Jamie, thank you so much.
Thank you.
All right, CRCL through CMHA Kelowna will be coming in early 2026. You can find out all the information. We have some background information about CRCL that you can find that on the A Way Forward podcast page at cmhakelowna.org. If you have questions about CRCL or any other episode, you can always email me at awayforward@cmhakelowna.org. Until then, please do take good care. This episode is supported by Beam Credit Union. With deep roots in BC and a commitment to your financial journey, Beam proudly backs mental health conversations that help build stronger, healthier communities.